I'm Brittany Garcia. I'm a student nurse at BSU. I checked your doctor's orders today, and he said that you need a wound change, a dressing change. Can I verify the name and date of birth, please? Okay. All right. Well, Miss McGee, we're going to go ahead and do your dressing change today. On a scale of 1 to 10, where 10 is the worst pain you've ever felt and 0 is no pain at all, how would you rate it? Okay, a 7, that's pretty high. Let me go ahead and get you the pain medication, okay? I'll be right back. Bring back my pain medication. Okay, Miss McGee, I need you to go ahead and take your pain medication for me. Here's some water. Okay, Miss McGee, I'll be back in about 30 to 40 minutes to continue with the procedure, okay? 30 to 40 minutes later. Okay, Miss McGee, how's your pain now on a scale of 0 to 10, same scale? Okay, good. Well, it sounds like you're about ready to get started. Let me go ahead and perform hand hygiene, and I'm going to provide you privacy. Again, the doctor has ordered for your dressing change, so we're going to go ahead and do that today. And where's your wound is on your rear? Okay, so I'm going to actually need you to roll over for me, so let me assist you with that. I would roll the patient over. Okay, Miss McGee, I'm going to go ahead and actually set you up to my height and get everything ready. I'm going to leave the side rails up until we get started, okay? But I need to make sure that you don't try and get out of the bed or anything, okay? And also, Miss McGee, I just want to go ahead and let you know that this is a sterile procedure, so you don't need to be moving around or anything or trying to touch anything, because then we'll break sterility and have to start over, okay? All right, so while I'm going ahead and setting up, if you'll just relax, and we'll get this going as quickly as possible, okay? Now, have you had a dressing change before, Miss McGee? No? Okay, well, Miss McGee, what's awesome about this dressing change is that it's going to make you feel a lot better, and it's going to promote healing, so that's always good, so we can get you out of here as quickly as possible. Also, you know, you need to make sure that you tell your family. Do you have any family members at home that are going to help you? You do, okay, and have they been shown what to do before? They have, okay, good. We just want to make sure that they know how to help take care of you then. Okay, so this is actually going to be my non-sterile field over here. So I'm going to move everything that's non-sterile to this side. So that once I put my sterile field, I never turn. So, I'm going to go ahead and open non-sterile here. And we're going to, this is going to be non-sterile, so we'll put it over here. This is going to be my sterile field. And we're setting sterile field here. I'm actually going to turn this way. Gives me a little bit more room. My sides to it. And I just got to make sure not to hover over that. I feel like this is a little too close. So we're going to move it here. Okay. Can't turn my back to it. See how this is a little bit tricky. But I can turn my back to my non-sterile field, which is over there. And I'm probably going to talk to myself a little bit, Miss McGee. It's just because this is kind of tricky, and I don't want to mess up. Is that okay with you? Okay, good. All right. And this is all non-sterile, so it can touch whatever it wants. This needs to come over here. Now, okay. I'm going to go ahead and place my gloves on this side. This is still considered non-sterile. This needs to be in a sterile field. But my container is non-sterile. I don't think that has to be sterile. Just remembering that this is sterile on the inside. Sorry, Miss McGee. Sterility is really confusing. You have to think a lot with that. Yeah, nursing school is really hard. You learn these things in nursing school. It's tricky. I'm telling you, Miss McGee. What do you do? You're a teacher? Oh, that's good. I'm going to educate my son when he gets to first grade. I'll make sure I request you as his teacher. Okay, Miss McGee, I'm going to lay you flat. Okay? No, I'm not. Try that again. But that was a little uncomfortable, but sorry about that, Miss McGee. Alright. I'm dropping your... Let me make sure I don't touch anything over there. Dropping your side rails, Miss McGee, so don't move for me, okay? Alright, let's see. Alright, so you've had a dressing change. Make sure to keep you nice and comfy here. Okay, well, your wound looks pretty good. I'm going to actually have to remove everything. I need to have my biohazard bag ready. So, I need to have my biohazard bag right here in this area. Okay? And so, I'm actually going to go ahead and look. Alright, Miss McGee, I'm going to remove this stuff one at a time. And I can't pull tweezers out because that's in my sterile field. So I'm going to use my fingers. Just let me know if it's uncomfortable, okay? Alright. As far as your wound goes, it looks really good. You seem to be healing pretty well. Alright, and I'm going to go ahead and throw this in my biohazard bag. Okay, so we have that ready. Well, it looks like we're ready to get started. And again, just make sure not to move for me, okay? So I need to think things through. I am a silly nurse, aren't I, Miss McGee? That's okay. Again, what's behind me is non-sterile, so I don't really have to worry about any of that. Whew. All right, let's get this started. Okay. I don't want this. Oh, what was that? I got an idea, Miss McGee. This is my sterile glove. I'm touching sterile to sterile. Look at that. Sterile to sterile. I know you think I'm silly. It'll work though. Okay. I'm gonna put these in here. Alright, looks good. Need some dry stuff here. More dry stuff. More dry stuff. Take my tape over here. Just get some touch this. Alright. Move these over here. So, Miss McGee, how did you get that ulcer? Aw, that's no good. You gotta make sure, you know, those motorcycles, you gotta wear helmets and stuff so that once you get bedridden, you don't, you know, you gotta have somebody rotate you. Okay. I'm gonna just get some stuff prepped for that tunneling that you have going on there. You're gonna wanna get that cleaned up nice and good too. I'm just gonna make sure that I have plenty of wet gauze in there. Too much never hurt nobody. Okay, I'm going to move this over just a little bit too. Okay, Miss McGee, well, we're going to get started real fast. Alright, I'm going to start with your tunneling. What I'm going to do is I'm going to dip this gauze, or this pad, in here, and I'm just going to clean in there, okay? Okay, now I would actually need to mark how deep your tunneling is in that tunnel. It's looking at about, I'd say, 1.5 inches. Mr. Key, I'm going to do another one into your other tunnel here. Okay, that one's a lot less deep. That one maybe, I'm going to touch that stick there for you, about 1 inch as well. Okay, Miss McKee, well, let's get this started as far as cleaning goes. I'm going to move as quickly as I can to keep you comfortable. Make sure I get up under here. Okay, I know it's a little uncomfortable for you. That is one gauze. You can see I'm wringing it out good. Gotta make sure not to drip it on anything. Okay, Miss McGee, that's looking a lot better. Okay, we already cleaned your tunnels, so I'm gonna need to patch you dry. I'm actually gonna clean the outside of your skin a little bit too. I would just use one clean gauze. Outside of your skin isn't too bad, but we're just gonna wipe it just in case. I'm actually going to discard that one because it scares me to pop out of there a little bit. Okay. Just want to make sure my gloves are nice and dry, so that when I grab a dry gauze, we're not messing anything up. I got your skin dry, Miss McGee, but it's going to be really hard to dry inside that ulcer, so I'm actually just going to push it on it a little bit and make sure that I expand it in there. And then you're patting it a little bit to absorb any moisture. And it looks like I got up all that moisture. Okay, Miss McGee, well, we're going to start packing this wound. I'm going to go ahead and drop a couple more gauze, it looks like, in there. I'm going to need a couple more. Getting close to my border. Don't want to wet anything, Miss McGee. I know I'm taking a little bit. Alright, you ready? We're going to start with that tunneling. While I'm at it, I'm going to go ahead and just wrap this around into your little pockets of skin under here. As I'm working my way around, I know there's a tunnel down in there. I'm going to get it in a second, but I'm just going to package that around. And I'll move that over a little bit when I get my tunnel ready. Oh, these things are so sticky, Miss McGee. Package this other one down in here. Good. Got good down in that tunnel. It's good and packed. Okay, Miss McGee. Well, we're going to go ahead and bandage you up now. Okay, so I'm going to keep that glove on. And I'm going to take some dry gauze here. That looks like about enough. and a pad up. Alright, take off my gloves. Remove my sterile field. That's okay if that sterility over there is broken now because it doesn't matter. And I'm going to tape you. This week after I tape you, I'm going to write on a piece of tape the date and time of the bandaging so that the next nurse who comes in knows exactly when it's bandaged. I'll also record this on my documentation for the doctor. Okay, Miss McGee, I know this is a bit uncomfortable as far as placement goes. But we want to make sure that you heal up okay. You make sure you're careful on that motorcycle next time, okay, Miss McGee? We don't want you to be bedridden anymore. Alright, and I'm going to ask my assistant to hand me a pen. Okay. I'll write the date and the time. I'm going to stick that right here. Alright, Miss McGee, I'm going to get you all covered up and comfortable. I'm going to put your side roll back up for you. Like I said, I'm going to document this and clean up my mess. Let me put you back up here. Let me help you roll over. Okay. Put you back up and lower your bed. Now, Miss McGee, your pain on a scale of 1 to 10, 10 being the worst pain you've ever felt. 0 being no pain at all. How would you rate your pain? Good. I'm glad to hear that you're feeling better, Miss McGee. I hope you have a good day, okay? Thank you so much. Clean up my mess, perform hand hygiene.